just to give everyone a second to cycle in. And I see a couple folks still in the way. I'm the public health policy and programs manager for the National Indian Health Board. I'll be your moderator for today's session. Kody Oliver joins us to discuss strengthening the accessibility and effectiveness of pediatric oral health programs in Indian country, especially in light of the COVID-19 pandemic. We're all old hat at this, but I'm just going to run through a couple housekeeping items. Everyone should be muted at this point. Yeah, it looks like everyone is. Please keep yourself on mute until Kody's done with his presentation, and then we can open it up for question and answer. And a recorded version of this webinar will be available for viewing post-webinar. My colleague, Adriana Marzette, can you like raise your hand or something, Adriana, so people can see you? She will post a recording to NIHB's YouTube channel on Friday. And as I'm sure this is your first question, she will also email all registrants a copy of the presentation and the recording as well on Friday. We encourage you to enter questions into the chat box throughout the webinar. Once we get to the Q&A portion, you can either type your question in the box or, like I said earlier, unmute yourself and ask your question. Again, just if you're not speaking during that time, please do keep yourself muted to remove background noise. And if you have any technical assistance issues, just private message either myself, Brett Weber, or Adriana Marzette. So with that, I'm going to turn it over to Kody. Kody Oliver is a 2022 Global Health Epidemiology and Disease Control MPH graduate of the George Washington University Milken Institute of Public Health. He completed a BA and BS degree in economics and chemical biosciences from the University of Oklahoma. Kody is interested in coupling and leveraging epidemiologic and economic evidence to promote preventative public health policies. He hopes to improve child health and to help eliminate health disparities in his career as an epidemiologist. So with that, Kody, I'm going to turn it over to you.
Awesome. Thank you so much, Brett. Can everybody hear me?
Yep, we can.
Okay. Go ahead and share my screen here. All right, so as Brett said, I am a recent MPH graduate from George Washington University in Washington, DC. About 6 months ago, I reached out to Brett and National Indian Health Board, interested in doing my practicum with this organization specifically. I was really interested in global health, and I always had my eyes overseas and seeing what's going on elsewhere. But more recently, I kind of realized that global health can happen in the United States also, and we're a very diverse country, and I feel like Indian health doesn't get the attention that it should, and I'm very much a beginner in working in an Indian country. This is my first real experience with trying to understand the IHS and all the different ways you can get healthcare or not get healthcare within Indian country, and the gaps in access that we have. So I wanted to focus on pediatric oral health in Indian country with the pandemic and shutting down clinics and maybe only doing emergency services or no services, or dealing with vacancies or supplying PPE to your staff. There was a number of issues that could have been prevented before the pandemic, but also, moving forward, we need to learn from the past and, protect and strengthen what we can. So, all right. So the main concern here are just cavities. For in early childhood, we call these ECCs. They're common, preventable, treatable. And they can obviously put children at risk of more serious dental issues later on if these aren't taken care of early. And I think more importantly, and maybe kind of overlooked, is the fact that poor dental hygiene early on can really, whether it's a toothache at school, that can really, distract a kid from learning what they're supposed to be learning at school. And I think there's a snowball effect or a compounding effect that can happen with health issues early on in life that aren't taken care of, and over time they just make it really hard to get back to a healthy baseline that is possible for someone. Another important point that I came across in just talking to people is a common perception that dental services for young children are symptom-led, while medical services are prevention-led. It creates a disparity in priorities between, what is a medical problem. You go to the doctor for your child to get vaccines, and most people are on board with that. But if there's no real reason to go to the dentist for your young child, it might be possible to assume that there's no issues there, and there's no real there'd be no value in prevention by making an appointment, going to the dentist, and talking over how you can protect or cure problems that are already there. And our stakeholders here are obviously our children, their parents, and the dental profession as well. So getting these three actors to come together is kind of the goal here. Okay, so this is IHS. This is from a data brief from the IHS recently, from March 2022. This is just some data they have on the pandemic's effect on oral health in general. And so on the left side over here, we see that about 16% of IHS tribal and urban dental programs are still not where they were before the pandemic. So, wherever these facilities are, they're really they're still not able to provide the services that people need on a normal basis. And this is 2 years after the pandemic. So and on the right side over here, vacancies are something that I've just been really surprised by within IHS and Indian country in general. Getting people to work out here, it's apparently super challenging. And during the pandemic, these workforce vacancies were exacerbated, especially for assistants and dentists as well. So adjusting pediatric oral health services to a post-pandemic setting. There aren't a lot of, I feel like we can always talk about access as just a major problem. And, if there's not the workers there to provide the services and the resources, then, it's a tall order to make happen. But tribes are innovative, and that's definitely something that I didn't know anything about until recently. But with dental therapists in Alaska, there's a lot of interesting stuff on creating a new profession that can fill a hole that can really help communities and protect kids from problems that don't need to happen. And it's been a lot to learn about tribal sovereignty and kind of trying to understand how this works in everything else that goes on in the U.S. healthcare system. And it was interesting, but yeah, I think the vacancies is a major one, and supporting people who want to work in this field, and if that means advocating or creating institutionally different positions that can fill a certain gap, then that's what we need to do. We need to be thinking and always trying to do better for these kids. And dental practices, there are new methods for fluoride delivery, fluoride paste. There's a lot of stuff out there, but yeah, as opposed to only fluoridated water, whereas a lot of communities don't have drinking water like that. So finding a way to protect the teeth actually in the dentist's office is a big one too. And this is another big one: medical and dental integration would be huge to connecting care. Like I said earlier, a lot of medical care is already happening for young children on a preventative basis. And, if in that visit, if there are signs of dental issues, then there should be a referral route or some way to connect this care, because, it's what they need. So best practices, this is kind of just what can we do right now? During pregnancy, we can educate mothers, counsel mothers, make healthy recommendations for, diet, exercise. There's tons of things that influence everything we do. Setting a dental appointment, just having a checkup, getting comfortable at the dentist. I'm certainly someone who doesn't like the dentist all that much, but it's something you got to do, and getting comfortable is a big part of it. From birth to 2 years, collaborate to ensure children receive oral health assessments. prevent caries via fluoride varnish treatments, educate families on nutrition as needed and on signs of caries, and provide encouragement to families. I think that's important also. I mean, cavities seem to be a pretty common thing, but providing encouragement to families that, this could happen and it's okay. I mean, these with the dietary norms we have, it's going to happen. So providing encouragement that, you can do something and protect your child still and fix these issues early on. From 3 to 5 years, collaborate to ensure every child has a dental home, and continue to assess, prevent, and educate families, children as they grow up. Taking care of their own teeth is going to come more into their hands, and yeah, I mean, it's an interesting problem just because this is a daily thing. Brush your teeth 2 or 3 times a day. It can be a challenge if you've got a lot of things going on and you're working a lot. And I assume most of the audience here are providers. So I'm not yet. I have interest in medicine, but I'm still a student. And as much as I would really like to be out there, I'm still working on, trying to understand and prepare myself to be the best provider possible. And just being able to talk to families and parents and try to understand and encourage, despite all the challenges that are there. It's important. I mean, this is something that I'm really excited about, and I'm glad that I had this opportunity. So that's about it for me. As I said earlier, I'm definitely not the expert here. I would certainly love to hear any thoughts, ideas, further thoughts on this field or this issue moving forward from people who have much more experience than I do. Thank you all for listening.
Okay, thank you so much, Kody, for providing that run through of the things that you learned from talking to tribes and tribal dental clinics in your practicum. We were very happy to host you, and I hope you learned a lot from National Indian Health Board and the tribes. We have a good amount of time left, so I want to open it up and see if anyone had any questions about anything Kody mentioned, or if you want to also talk about your tribe's experience with pediatric oral health in the past couple of years. We're happy to provide a forum for that discussion as well. So I'll open it up. Okay, we have a comment from Aaron in the chat. Tell us about the CHAP community health aid programs and dental programs. So Kody, do you want to talk about the dental therapists that you spoke with over the course of your practicum? And I also work on that issue, so I can also take a stab at that if there's still questions after you're done.
Sure, thank you. Yeah, dental therapy was a pretty interesting idea and occupation now that I didn't know anything about. And I think I talked to one dental therapist. Another thing I just think I should say is it was kind of tough to get into contact with people. I think people are just busy, or a cold email might be something hard to respond to. But yeah, and people are busy, of course. So getting the data was a challenge. So what I have on the CHAP program is part of. I'm certainly not the expert. I don't think I'm going to get all this right. But in 2003, Alaska introduced a dental therapist program as part of the CHAP program, and I believe that I don't understand all the sovereignty dynamics here and how the tribe in Alaska is able to just set this up on their own. I don't understand the CHAP component of it fully, but yeah, dental therapists, I believe, can fix cavities, fill cavities, and that's not necessarily something you need a fully trained dentist to do. And that's kind of where the value here comes in. It seems that you don't need 4 years of training to be able to fill cavities. And so, a year or two of training and putting these people into the community where they can work now, as opposed to 3 or 4 years later, it seems to be where the value is with dental therapists.
Awesome, thank you, Kody. And I'll just add on the kind of the more policy side of things, the way CHAP works, it's funded by IHS, the Indian Health Service. And as of right now, it's specific to the Alaska area. So it's administered by ANTHC, the Alaska Native Tribal Health Consortium. IHS is in the process of expanding it to other areas across the country. And there are 3 components of CHAP, dental being one. And the really cool thing about the program, it empowers community members to become providers. So like on the dental front, there are about, of 200,000 dentists nationwide, only about 150, 160 are native, right? Dental therapists, on the other hand, there's, dozens and dozens practicing in Alaska. Most of them are Alaska natives. So they're coming from their home communities, getting trained to be these providers and going back and serving their community, as Kody mentioned. So it's a really cool way to get more native oral health providers. So that's what I'll say about that. Sorry, I could go on. I work on DHAT, the dental health aid therapist. So I could go on and on about that, but I'll stop now. So Kody, I'll ask a question while other folks think. So now that you're kind of concluding your practicum and looking at your future as an epidemiologist, what are you hoping to do, in the medium-term future? And then Julie, I'll get to your question as well.
It's a very good question. Well, now that this was my my first experience working with tribal health issues, and so, but it's something I'm interested in keeping working on. But I'm not really sure. I've considered medical school in the past, and that's still something that I'm considering. So kind of between options there. But in the short term, I'm probably going to be looking for work at a state epidemiology clinic, or sorry, a state health department, or a local health department. Kind of just going to see what's out there and see where I'm willing to move to, type of thing. Julia, you have a question? Or...
Sure. Thank you first, Kody, for sharing this information with us. I know many of us on this call realize the extreme conditions around oral health, particular for Native American communities. And you mentioned stakeholders being parents, families, and dental providers. And I'd also just like to really emphasize it's also the community. And one thing that the tribes do so well is use community health workers or community health representatives to have messaging around several different health issues with families. And I'm wondering if your research, your information or knowledge, you could expand on how oral health is being incorporated into what CHR's work is occurring in tribes.
I'm not sure. I don't think I really came across much on community health workers or community health representatives. I tend to assume that they do serve a educational component, but I'm sure this is one of those things that there's a lot of value there, but it's likely there's just not the funding for it, or getting the staffing for those people to go out and work their volunteers. That's a challenge of itself, but no, it's definitely not something I focused on. But yeah, I mean, education, the community, like you said, I definitely agree. but for my presentation, I was just trying to kind of focus it down. It helps me to think about just the child, parent, professional, the triad there of, the child doesn't really have much say in what's going to happen. So, is it the professional or is it the parent that's going to make this happen? Oftentimes, I think you're right that it's going to come from the community. The community is going to influence the parent or a professional or, but you're definitely right. I wish I had more to say on that. I'm sorry.
Thanks.
Yeah, and we also definitely saw CHRs being an absolutely vital resource and for tribes that use them during the vaccination period. See a question in the chat. Kody, did you come across any like standardized fluoride treatments in your practicum, and if that was at IHS or tribal facilities, and was that disrupted by the pandemic?
I'm not. I assume fluoride treatments were, because that would be a routine non-emergency service, and I know they were definitely disrupted early on. But fluoride toothpaste is an option, and this isn't something I pursued vigorously, because there seemed to be quite a bit out there on fluoride treatment in the clinic. With silver painting. It's a little beyond my knowledge there, but I'm not sure on the standards of fluoride treatment with the IHS, or if there's, not sure.
Okay, I don't see any other questions in the chat. So we can wrap up today. I'm going to give it another minute, because every time I say that, there's always someone that pops up with a question. So now's your chance. But yeah, and there are some resources that Dree is putting in the chat around preventative services, including varnish for pediatric dentistry that IHS and tribal government and tribal health systems run. Birdie, I want to address your point as well. CHAP expansion is ongoing, so there are areas that do have CHAP infrastructure set up. Northwest Portland is one of those areas, but not all of the areas outside of Alaska have CHAP yet. But thank you for that clarification, because Northwest Portland and I work with them frequently. They are working very hard on that, and I think I see a hand raised, but perhaps it went away.
Miss Schuyler. It was Miss Schuyler.
Yeah, hello. Hi, I'm a research coordinator here at NAU in Flagstaff, and we're in the process of doing kind of a study in the same area. But I've been talking with a lot of dentists via interviews the last couple of weeks, and a common theme of also presented here was just more education is something that's needed kind of on all ends. But I've been coming across basically dentists trying to get the education out, but it's not sticking with any of the mothers. So I was kind of wondering if you came across any specific tools or education methods that have kind of been better than the other, rather than just the dentist just relaying information at the time of their appointments. So if there's anything like IHS has done, I know they've done various things in the past with trying to get education dissemination out, but in this area of dental work, has there been anything there kind of recently is my question. Thank you.
As far as a education method that would be more effective, I'm not exactly sure if there's something that has good evidence behind that, but I know the IHS is releasing short like infographic materials that try to be very concise and get straight to the point with it. But also at the same time, I think with oral health, this is kind of it's just with our diets, or failing to brush enough, or failing to floss enough. I mean, I feel like there's a lot of ways to just fall between the cracks and get a cavity or get cavities. And I feel like going to the dentist, and personally, this is my experience, I feel like going to the dentist and having to have a procedure done was the most motivating thing for me to take care of my teeth more when I was a young kid. But ideally, we wouldn't have to go through that to learn it the hard way, basically. So yeah, I mean, I think it's and I also like to keep in mind that people are very busy. People work full-time jobs, have kids. I don't have kids. Sounds like a lot. I don't know. But trying to just understand that, keep that in mind, and meet people where they are. And mothers have a lot to do already. And yeah, I mean, I appreciate the research you're doing on just trying to find something more effective that sometimes is images that this is a sign of an early carie. Sometimes that would be better, I would think, but yeah, I'm not sure on the evidence on that, but thank you.
Thank you.
And Brett, if you have anything on that, I'd be happy to hear.
I don't think I have a lot to add there. Just saying that, education being an ongoing thing, that, we can't just say like, oh, we've educated the community and we're done, right? That's an ongoing thing. People have, children all the time, and that needs to be an ongoing, sustainable thing. And, a lot of schools, were disrupted over the pandemic, and, making up for lost time in that environment is going to be something the education system, tribal and non-tribal, is struggling with. Oftentimes oral health providers or CHRs and other workers would go into the communities and do this education via the classroom, right? And that became an impossibility for a lot of people for the past 2 years. And some of that gap is contributing to the disruption of pediatric dentistry. So that's I think all I would want to add there. And I see a question in the chat that I think is directed at me or Drea at NIHB around paying for the fluoride varnish, silver diamide, and whether that's an issue. It's an issue in Alaska, the billing for it, and whether that's an issue nationwide. I do not know the answer to that question, but I am writing it down, and I will follow up with you, Francis, to get an answer to see nationally what the pay for services are like for that. Okay, and then Kody, there's a question for you. For oral health communications purposes, are there certain needs that tribes are specifically seeking more information on that you came across during your practicum? Or are there points of emphasis to promote to dental researchers or practitioners interested in working with Indigenous communities?
Sorry, I'm trying to fully understand the question. For me, I only talked to a handful of tribes, about an individual from each tribe. So I'm not sure if I can just say, or if I can just say that tribes are looking for something specific from a communication information standpoint. Just to note. I think this is a tough one. I mean, I don't want to just say that being culturally competent, or being from the community you're working in is the best way to do things. But oftentimes, it could be. But like also, like, what is cultural competence exactly? I haven't worked in the field with patients myself, so I don't think that I can just assume that I could do that. But I think when working in tribal country, it's important to understand some of the unique factors that will go into different health conditions and outcomes. And so I think it's important for researchers and practitioners interested in working in these communities to always keep that in mind, because there's a lot of history that is important to know, and it's important in influencing what's going on now. So. For Lisa's question, I didn't touch on maternal health very much. I don't understand the second sentence fully, but I did have a slide where I promoted having pregnant mothers go to the clinic and try to set up a dental appointment early on to be proactive in taking care of their child's oral health needs even before they're born. Robin, I think that's an excellent idea, making videos. It seems like everybody's watching videos nowadays, and something short and catchy that I feel like that could be pretty effective, probably. I assume dental CHRs are more common in more of the Western states. Would you say that's right, Brett? I'm not exactly sure on that one.
I actually do not know the like distribution of CHRs. That is actually a really interesting question, and now I'm curious myself, and I want to look into it. As far as billing, they are there's a CHR line item in the IHS budget that for self-governance tribes gets included in the compact and contract costs annual funding agreements, and for direct service tribes is obviously just part of the facility budget. So I hope that answers your question there on like the financial side.
Wow. Yeah, thank you for bringing that up, Birdie. I didn't know about that history or that specific the teeth pulling, but yeah, I mean, it's not all that surprising to me. Lisa, thank you for clarifying. I think, yeah, I mean, I hadn't thought of this one, but yeah, I mean, that's maternal health is totally right there also, and I think it's probably safe to assume that if the child's oral health needs are being taken care of, then maybe the maternal health needs there are also, or if both of them aren't, then that's a big problem on top of a big problem that I wish I had a better answer on how to solve, but. Yeah, thank you all for these questions and comments. I really appreciate it. I'm not the professional here that you all are, so I appreciate this opportunity and you all being here.
And also, my colleague Dree, Adriana, we call her Dree, is putting some great resources in the chat that Kody looked at during the practicum as well, and that you might also find helpful based on some of the questions that are being asked. So be sure to check out those links in the chat for sure. Okay. Well, is Kody, is there anything you want to say in closing? I think we.
I have a comment. I have a couple comments, private comments, where we have been asked to share awareness materials. So has anyone, organization, health department, or health program have any awareness materials that you can probably mention here so that I can go to your program's website to pull them, to share them with other people on the phone. Please, you can IM me privately, or you can like put the name of your program in the chat so that I can quickly go to that to share those resources. So again, if you have an oral health program, if you all have created awareness materials on ECC or on youth education materials on brushing the teeth, please share your program name or where I can find those resources. Thank you, Rudy. Thank you, Michael.
Okay, then. Thank you so much, Dree. Yeah, and thank you again for those of you putting more resources in the chat. That's awesome. Really appreciate that. So Kody, is there anything you want to say in closing before we wrap up today?
It's been a great opportunity. I'm really glad I reached out, and I've learned a lot. I've got a lot more to learn. Hopefully I can be working with some of you all sometime later on in the future. There's also a lot of great materials in the chat here. I've been clicking through and I'm still learning. So yeah, just thank you, Brett. Thank you, Adriana. Thank you everybody for being here. I've learned a lot today. Yeah.
Great. All right, so just one more bit of housekeeping before we close, and we will send this out as well. As I mentioned earlier, Dree is going to be uploading this recording onto our YouTube channel, and we'll send out the slides and the recording to everyone who registered for the webinar. And if you're on the webinar, you registered for it. So expect that email later this week. And I just put in a, and Dree did as well. There's a link to a short evaluation survey. It'll take you 2 minutes. But please do fill that out. It's wonderful feedback for NIHB to get. We do go through the evaluation data to provide quality content for you that is helpful to you as a tribal public health and healthcare professional. So really, again, thank you so much for everyone joining us today. And thank you, Kody, for not only this webinar, but for sharing your practicum with National Indian Health Board. We loved having you, and we wish great things for you.
Thank you, Brett.